Hi guys! So for today's video, I'm gonna start another series. It's gonna be the first aid series. So for this first part of the first aid series, I wanna go over special medical scenarios, emergency medical scenarios actually, and what we have to do in these scenarios and what we have to keep in mind when we encounter these kind of scenarios, in our daily lives or when we are working in the hospital. For this video, I want to go over 5 emergency medical situations that are quite common. So it's really important for us to study these. So firstly, I want to talk about what do we do when someone has an anaphylaxis, and then what do we do when someone has syncope or a fainting episode, and then what do we do when someone has a stroke, what do we do when someone has low blood sugar, secondary to having diabetes, and what do we do when someone has a seizure. So let's first start with allergic reactions. What is actually an allergy? So an allergy is just the overreaction of our immune system to foreign substances. And sometimes these substances are not really that harmful at all, but our body, gets triggered, our immune system reacts to it anyway as if it's something that's going to be harmful to us. An allergen is anything that can elicit an immune response that could trigger our immune system. Some of the most common allergens include medications like penicillin. Food is quite common, so people may have nut allergies, egg allergies, allergies to shellfish. People may also be allergic to insects, specifically like insect bites, like bee stings, for example. Allergic reactions can either be mild or severe, but we need to keep in mind that some allergic reactions that might appear mild may become worse, so may progressively become severe in minutes. So when someone is having an allergic reaction, especially if that's the first time that they've reacted to that substance, then we have to stay with them and just see how the situation pans out. Some of the signs of a mild allergic reaction include stuffiness in the nose, sneezing, itching around the eyes, itching of the skin, and sometimes we can get these raised red lumps that appear. They're called hives. They're also a sign of mild allergic reaction. We can also get abdominal pain and even vomiting, especially if it's a food allergen. And some of the signs of severe allergic reaction that we need to be aware of include difficulty breathing. So the patient would complain that they are struggling to breathe, and they might feel that there's an obstruction in their airways. And they might also complain of swelling, so swelling in the face especially, but they can also have swelling in other areas like their hands and their feet. Their tongue as well can be swollen. They might come with signs of shock, so that's like low blood pressure. They might also complain of dizziness, confusion, weakness, and they might even lose consciousness. Severe life-threatening allergic reactions are called anaphylactic shock or anaphylaxis. So this can precipitate within seconds to minutes of the exposure or the consumption of the allergen. And the patient may die if treatment is not initiated promptly. So just to explain some of the symptoms that we see in anaphylaxis in simple terms and without making it overcomplicated. So basically what happens upon the exposure to an allergen or the consumption of it is that our body releases, our mast cells specifically, they release this substance called histamine. And histamine does a cocktail of different things in the body. But firstly, what they do, well, not firstly, but one of the most important things that they do is they dilate the vessels. So an increase in volume in the vessels mean a decrease in blood pressure. So once they trigger vasodilation, that then precipitates low blood pressure because we're increasing the diameter of the vessels, and that reduces the blood pressure significantly. And this happens in the whole body. So this is a generalized vasodilation. It's not just in specific areas. This is why the blood pressure really drops by a lot. And then they also make the capillaries more leaky. And this then explains why we get the swelling and edema. Histamine can also do other things like bronchoconstriction. So that's why sometimes they feel that the airways are blocked obstructed or tight. Histamine can also trigger the release of adrenaline and trigger the inflammatory response. Usually, people with known severe allergies would carry an Epipen with them. So it's a self-injectable epinephrine that comes in this little pen thing. This is not it, but I'm just gonna demo how to use it. So they carry that with them everywhere. It's available by prescription. There's two different types. There's the spring activated and the electronic version, and they might differ slightly based on the manufacturer. So what you do is you hold the EpiPen with you just make a fist and hold it like this. Bear in mind, you shouldn't touch either ends because the needle would come out in one of those ends, and if you're not using an EpiPen yourself, you wouldn't kind of necessarily know where the needle end is. So just for safety, don't touch either ends. And what you do is you remove the safety cap, and then you place the needle side on the side of the thigh, just kind of like halfway between the knee and the hip, and you press it firmly for about 3 seconds. Again, it depends on the type of EpiPen, because some you need to press for 10 seconds. So you either ask the victim if they can still speak, hopefully by then, or I think there would be some instructions in the packaging. So you hold it and you press it firmly for 3 seconds or 10 seconds, depending on the manufacturer's instructions, and then you pull it straight out. And once you pull it out, massage the area, or just rub the area for about 10 seconds. And what you do with this is you dispose it accordingly. So if you're in the hospital, put it in the sharps bin. If you're just in, a normal people environment, then you keep it with you and you hand it to the emergency services when they arrive to be disposed properly. Also, what you do is you need to note down the time that you've administered the epinephrine. So moving on to the second medical scenario, it's fainting or syncope. So this happens when someone falls unconscious, usually for a short period of time, like a minute, and then they recover. This happens due to the temporary reduction in blood flow to the brain, leading to the loss of consciousness. And oftentimes, people would feel dizzy before the syncopal episode. There are many different reasons for fainting, and some of them might not even be life-threatening. So, for example, a person can faint if the person stands up really quickly after having not moved for a long time, especially when it's hot, or if someone hasn't eaten enough or drunk enough in a while and then suddenly stands up, or if someone receives a bad news or encounters other stimuli that may provoke fear or surprise, like someone might faint at the sight of blood, or at the sight of something that they're really afraid of, like spiders or snakes. So these are not really life-threatening, but they can also be due to arrhythmias of the heart, and that can be life-threatening. So our main concern at this instance is not to investigate the cause of fainting. What we need to be concerned of is the fact that if this patient falls, is it going to be safe for them? Because they might hit their head, they might break bones. So what we do is when we are about to see someone to faint, if someone, for example, tells you that I feel dizzy and I feel like I'm gonna faint, what you do is you remove all the dangers in the surroundings, verify that the scene is safe, move any hazards around or any objects that might hurt them when they fall. And then what you do is you help the patient to slowly lie down to the floor, and you call the emergency services, because they might then become unresponsive in a few minutes. It's important not to leave the victim until the victim feels like normal again, because as I said, the victim might become unresponsive all of a sudden. And if there's another person around, then you ask that person to activate the emergency response system if you haven't already, and get the AED. And why? Because you never know that the cause of this episode might be due to heart arrhythmias, and this might happen again and they might become unconscious. It's better to be safe than sorry. So when you've witnessed someone faint, what you do is you approach the victim and you place them in a shock position. So you elevate their legs and you cover their body just to keep them warm. And you call the emergency response services. You may also turn the victim's head to the side if you don't suspect any neck or spine injuries. And when the victim starts to respond, then you just kindly ask them to just continue lying on the floor or, sitting until they feel normal again, until they feel ready and capable to stand up. So when they start responding, what you could also do is to check for any injuries. So we need to rule out, the potential deadly ones like concussion or any neck or spine injuries. And you just have to ask the patient, so what happened? Are you okay? Are you feeling hurt or do you feel any pain anywhere? And if the patient says no, then still call or still wait for the emergency services to arrive just so they can be assessed by someone who's better trained than you are. You also need to assess the victim's pulse and breathing and their skin. So if they are still pale and sweating, then that means that they are still not okay, they're not still back to normal. So you stay with them until the medical emergency services arrive who can take over, or they might become unresponsive again. So be prepared to deliver high quality CPR if needed. Moving on to the third medical emergency that we might encounter. So we might encounter low blood sugar in patients, especially with diabetes. So diabetes is a metabolic disorder that affects how our body regulates sugar in the blood. So too high or too little blood sugar is dangerous. And usually people with diabetes, they take insulin to regulate their blood sugar, especially after a meal, for instance. And taking too much insulin causes the drop, so the low blood sugar. So like I said, high blood sugar can also cause its own problems, but in this specific video, we're going to focus on just the problems with low blood sugar and how we can address this. I've already mentioned that low blood sugar could be the result of injecting too much insulin, but this can also happen if a diabetic person forgets to eat or forgets a meal or skips a meal intentionally, or has not eaten enough for the level of activity. So if they're exercising a lot and they haven't eaten enough. Also if they're vomiting. Signs of low blood sugar may precipitate in minutes. These include changes in behavior like confusion, irritability. They might feel thirsty, they might feel sleepy, they might feel weak. In terms of their skin, they might look pale, they could be sweaty, and they may also even have seizures. So what do we do when we spot these symptoms in a diabetic? So firstly, if they can sit up and swallow, we ask them to please consume liquids or food that contains sugar that will rapidly restore their blood sugar. So this might include something like orange juice, whole milk, glucose tablets, those soft chewy candies or jelly beans. It's important to remember though that if they consume like soft drinks, for example, that they drink the regular soft drink, not the diet version, because the diet version doesn't actually have any sugar. We need to keep in mind that we need to give them fluids or food that is easily digestible and that would get that sugar back in the bloodstream like ASAP. If they don't respond to this, if they don't get any better in like 15 minutes, then we have to call the emergency response system. And if the patient cannot sit up and swallow, if they've become unresponsive, then we have to activate the emergency response system. We don't feed them anything when they're unconscious. The fourth emergency scenario is stroke. Stroke occurs when blood flow stops to a particular part of the brain. And this happens either because of an obstruction or the occlusion of the vessels in case of an ischemic stroke. So this can happen due to a thrombus, for example, or an embolus that's been lodged there. Stroke can also happen due to the rupture of the vessels in the brain in case of a hemorrhagic stroke. It is very, very vital to spot the signs really quickly and to get help fast. and to initiate treatment rapidly to reduce the damage in the brain and to increase the patient's chance of recovering. So to recognize the signs of stroke, we use the FAST method. So F stands for face. So what we look for is facial droop in one side of the face and maybe the weakness or the numbness of that side of the face as well. So what we could do is ask the patient to smile or raise their eyebrows, and if they're unable to do that in one side of their face, then it points to a positive sign for stroke. Then the second component, A, stands for arms. So we look for, again, arm weakness or numbness in one of their arms. What we can do is ask the patient to lift both arms to their side, and if they're unable to do that in one arm, then again that points towards a positive sign. Then the next component, so S stands for speech. So is their speech slurred? So if their speech is slurred and the other elements are positive, so facial droop is present, arm weakness is present, and again speech is slurred, then T, it's time to call for emergency services. So what are the actions that we need to take when we see someone having stroke? So first of all, we need to activate the emergency response system if we haven't already, or get someone else to do it if there's someone else present. And you ask that person as well to get the AED, just in case this person becomes unresponsive, and we need to be prepared to deliver high quality CPR if needed. And we don't leave the victim. We stay with the victim until the emergency services arrive. Also, we need to note down the time when the symptoms first appeared. The final medical emergency that we're going to talk about today are seizures. So seizures are just abnormal electrical activity in the brain. Most of them stop within a few minutes, and most of them are caused by a medical condition called epilepsy. But seizures can also be caused by a number of other things like poisoning, heart-related injuries, low blood sugar, head trauma. The signs of seizure may differ greatly between patients, but the most common ones would be that, like, the patient would fall unconscious to the floor. They would have jerking movements of their arms and legs and complete loss of muscle control. They might also bite their tongue or hit their head, on the floor because they are shaking uncontrollably. Some patients may just not have these uncontrollable muscle movements. They might just be still and suddenly stop responding to you. After a seizure, it's not unusual for patients to feel drowsy, sleepy, and even confused. So what are some of the actions that we can take to help a person who is having a seizure? So first of all, we need to move different objects around that might be a hazard or might pose a danger to them. So we just move that around, and then we protect their head. So we put a towel under their head, or we just cushion it. We just hold their head still, just so they don't bang their head and cause further injuries. And we try our best to activate the emergency response system. If we can't do this because we're trying to hold the patient down and still, then we can get someone to do this. Hopefully there's someone around. If not, then we shout for help and we wait for someone to come to us and activate the emergency response system. We can also ask that person to bring us a first aid kit because we need to address the patient's injuries after their seizure. So for instance, if they've bitten their tongue, then that would be bleeding. So we need to just, or if they've hit their head, then there would be some bleeding there. So we just need to address these injuries after their seizure. After the seizure, what we need to do is we need to check for the patient's breathing and circulation. So we need to check if they're breathing normally and if they have a pulse. If they're responsive, then great, but bear in mind that they might be a little confused and not remember what just happened. So you just need to be patient with them, and even if they're responsive, do not leave the victim until the medical services arrive. If they are vomiting fluids, for example, then we need to roll them into the recovery position. And if they are totally unresponsive, meaning no pulse, no normal breathing, or just gasping, then we need to be prepared to deliver high quality CPR.